Please introduce yourself.
Hello, everyone. I'm Dr. Sejal. By profession, I'm a homeopathic physician. Basically, I'm from Mumbai and practicing in Bangalore past 20 years. I'm a very passionate homeopath. And in past few years, I was observing that I was getting a lot of patients of thyroid, PCOD, diabetes, obesity, hypertension, hyperlipidemia. And I was searching for some more holistic approach for them. As a result of which, I got into the practice of holistic wellness, by which I'm helping a lot of people all over the world to reverse all these issues in a very faster and a permanent way. So today I'm going to present the case study of a young boy who is 15 years old. He came to me 2 months ago. He was diagnosed with hypothyroidism, and at that time his TSH level was 10.9. And I understood his issues, and he didn't have any symptoms though, but mother was very anxious that she wants to reverse the TSH and does not let him be with it for a longer time. So I explained that it can be reversed and with lifestyle modification, and I brought changes in his diet, in his exercise routine. I made him more active, worked on his stress, gave him some nutritional support in form of plant nutrition supplements, and as a result of which in 2 months his TSH came down from 10.9 to 3.1. So today I would like to share that journey with of Swayam. So these are his reports, where earlier it is showing TSH as 10.9, and after 2 months it is reduced. So without wasting time, let's welcome Swayam and his mother Akshata. Can you spotlight Swayam? Yes, there you are. You can unmute yourself, Swayam. Yeah. Hello, welcome, Swayam.
Yeah,
Good to see you.
good evening, doctor. Good evening to all the other doctors as well.
Yes,
So
Swayam.
I'm Swayam.
Hmm.
I'm about 15 years old. I live in Bangalore, and I've just started off with my 10th grade.
So, Swayam, can you tell everyone that how did we connect?
Okay, so basically, my parents are patients of Dr. Sejal, and I used to get treated with her with homeopathic medicine for cough, cold, any common health issues. And like out of a sudden, I was diagnosed with hypothyroidism, and Dr. Sejal was the only one who assured me to reverse it without any permanent medicine.
Right. So tell me, Swayam, that why was the blood test done? Did you have any symptoms at that time?
Actually, no, I didn't have any symptoms. It was done because my dad was not well, and Dr. Sejal had suggested to do a blood test on a certain parameters for him. So since he was getting it done, my mom suggested that my mother and I to get it done.
Yeah. So many
So
times in
yeah, so
children,
this
it is not having, it is asymptomatic.
yes, okay.
So tell me, Swayam, that were you worried when you saw that when your parents told you that it is high and you need to work upon it? Were you worried about it? Did
No,
you have? Go ahead.
actually, I was not very well aware of what hypothyroidism is.
Hmm.
So I just used like the doctors and my parents told me it's a very serious issue, but I just used it as an excuse to get my lifestyle back to normal as a normal
Hmm.
person, healthy person.
So what was your
So
knowledge
it was a
about
huge opportunity
hypothyroidism?
for me. All I knew was thyroid was a certain gland located in the neck region. I didn't really know what it was, but it sounded familiar to me.
Okay. So can you share, Swayam, that how was your lifestyle, in the sense, how was your diet and eating habits before you had this diagnosed?
Okay, so basically, I used to eat a lot of unhealthy food at very bad timings. I used to eat at about 9:30 in the night, and it was never like a permanent schedule. I kept on changing my eating habits every day. So I used to eat a lot in the night, which I'm not supposed to do. I realize now. And I used to eat a lot of maida, gluten. I used to eat a lot of dairy. I used to eat a lot of sweets. I used to have a lot of sweet cravings.
And also you're craving for chicken biryani.
Okay, no. So basically, what happened was started getting slightly bored of home food because it was all the same flavors.
Right,
So I wanted something with a mix of flavors. So this was what hit me.
right. And also that restaurant which opened across your house made it even worse.
Yeah, yeah. So about a few days before I was my diagnosis, it was like every alternate day I used to eat there. So as soon as I got my diagnosis, it was basically like a small pinch saying that what are you doing kind of thing.
Yeah. And also your water intake, how was it earlier?
My water intake was extremely minimal. It was about 1 liter to 1.5 liters a day. So now it's better. Yeah.
Yeah. So tell us now, what changes have you made in your eating habits?
So first of all, I've cut off gluten products, dairy products, and sugar products, and any packaged products.
Good.
So it's all like fresh food, and I like about until my diagnosis came back to normal, I was on a very strict diet. But once I got my diagnosis, I've opened up a little, but I've learned how to balance my food routine.
Correct. So you started enjoying home food, fruits, vegetables, salad,
Yes, I do enjoy fruits, and whenever I'm hungry, or if by chance I do crave sugar, yeah, I do snack on a fruit.
because I remember mom telling me repeatedly that Swayam doesn't eat fruits, he doesn't eat vegetables, do something about it. So, and you had fixed
Yeah,
timings for your school. So from 7 to 3:30 you were
yeah,
busy. So we had to plan according to that schedule, where to fit in a protein, where to fit in
yeah,
a salad, where to fit in 2 liters of water. So we had planned everything. So I remember
yes,
first time when
yes,
I'd explained to
yes.
you, you were like wondering how will this implement? How will I implement all this? But eventually you
Yeah,
did.
it was a very big overnight change for me. It was like a drastic overnight change, but I have learned how to deal with it.
So was it difficult or it
So
was
yeah,
easy for you?
it was somewhere in the middle. It was difficult to keep doing it, but it was easy thinking that it would do good for me in the future.
Good. So you had that awareness in your mind.
Yeah,
So now, after making all this lifestyle reset, do you see any positive changes in your health?
I actually do. I see that first of all, I don't know, but somehow the nature of my hair has improved quite a bit, and I've had a lot of acne ever since I hit my adolescence. So it's never stopped. It's always like back and forth. But ever since I changed my diet, it's like forced to stop. If you, yeah.
Yes, true. What
So
about your weight loss?
oh yeah, as soon as I started the program, I've lost about 5 kg, and my physical activity has drastically increased as well. So it used to be I used to play badminton about 3 times a week previously to the program. But now every morning at about 5:15, 5:30, I have my workout. I have a trainer who comes home and he helps me do my workout.
And about that, I had told you to do Surya Namaskar and yoga for thyroid. That too, you
Yes,
have incorporated it so well in your routine.
yes, yes. So my fitness trainer helps me do various breathing exercises, and he does make me do a couple of rounds Surya Namaskara every day without fail.